A number of provinces are being badly hit by the third wave of this pandemic. Tomorrow, Quebec is putting several regions back under tougher restrictions. Ontario is also expected to announce stricter measures. It has more COVID-19 ICU patients at this moment than ever before. BC is in a 3-week circuit breaker after reporting record high case levels, and Alberta is seeing a positivity rate of more than 7%. 3% is considered pretty high. Public health officials say highly contagious variants are behind the spikes. Dr. Howard Njoo is Canada's Deputy Chief Public Health Officer. He joins us now. Hi, Dr. Njoo. Thanks for making time for the program again. We really appreciate it.
My pleasure.
Doctor, I wanted to start off, we listed off some of what's happening in various provinces. Could you contextualize for us, when you take a look at that information, is this the quote unquote worst point of the pandemic since over a year ago?
I would say certainly it's very concerning. I can't speak, for individual provinces and territories, but certainly I heard that from Ontario, in terms of ICU admissions, it's sort of at the peak, even compared to what happened previously. So I think all across the country, but I would say focused on the 6 provinces west of the Atlantic, things aren't looking good right now.
And what is, from your perspective, and I know it's going to differ a little bit depending on the province, but are there certain things we can take from a countrywide view? What is behind the increases?
Well, as we've been saying for some time since we first discovered that variants were coming to Canada or were identified in Canada sort of in December, unfortunately, they've spread and propagated. And you can see now we've got well over, I think, 10,000 cases of variants identified and reported in Canada, and probably many more cases that are sort of just being identified now that probably will come to light later on. And what's concerning is, I think, in provinces like Ontario, I think the percentage keeps increasing in terms of the total proportion of cases that are due to variants. I think at the latest count, it was 67, getting close to 70% of cases. And as we know, the variants are generally the ones we're concerned about, more transmissible. And even data coming out of Canada, obviously Ontario again, showing that they lead to more severe health consequences, hospitalizations, and increased risk of death. So all put together, it is quite concerning.
What response does that necessitate?
Well, I know that it's the ongoing issue and challenge. We all know what we need to do. So even at an individual level, in terms of the personal protective measures, the hand hygiene, the physical distancing, the face mask, and all that's all been repeated a number of times. And certainly, what authorities are also doing is that when they see that, unfortunately, when cases and the lagging indicators of hospitalization and deaths increases, then they have to go into lockdown. I think at this point, it's all a matter of people recognizing that it's the number of contacts you have outside of your household that leads to the ongoing spread of COVID-19. And so especially with Easter weekend coming up, we've seen this before. Every time there's a sort of a long weekend with a holiday celebration, be it Thanksgiving or over the Christmas time, same thing right now with Passover and Ramadan and all these other occasions for families normally to get together. I think the message has to be loud and clear. And I think across the country, we're saying all the same thing. Stay at home, stay with your close members of your household only. Other members of the family do celebrations virtually or outside. If you can do it safely. But otherwise, really, it's all about hunkering down. We're in a tough period right now. Spring is coming, but it's not really, really warm weather in many parts of the country. And so I think we just need to, as they say, batten down the hatches for hopefully in the next few weeks until the weather becomes warmer. And then hopefully Canadians can also take advantage of safe outdoor activities.
Let me dig down into that period of time specifically, only because my guess is your inbox is as full as mine, with people who are supportive of course, taking measures to curb the spread, but very apprehensive or feeling very anxious about the prospect of looking down the pipe at facing another lockdown. Maybe they're business owners, maybe they're just looking at the possibility of schools being closed and trying to work from home with their parents. But there is a lot of anxiety around it. When you look at the vaccination program in this country, do you think if there is a lockdown, this is likely the last one?
Oh, that's hard to say because the vaccination program I think is certainly the light at the end of the tunnel that everyone's looking towards. Right now, we're slightly over 10%, 10, 11, 12% of eligible Canadians who are eligible to be vaccinated, having received at least one dose. But we still have a ways to go, and even the vaccination, I would say, is not the silver bullet. After everyone gets the one dose, certainly there's a certain level of protection. But we still have to keep up with the public health measures because, as we just talked about, with the variants being so transmissible, I think we can't rely on the vaccines alone. So I don't know what to say about future lockdowns, but I would say that at the present time, it's so important to really limit the number of contacts you have and really try and keep to just the members of your household.
If we do, though, for example, after that first shot, after a substantial portion of the population has been vaccinated, see a decrease in, for example, the number of deaths, does that augment the types of restrictions that have to be put in place? And I'm asking you for, I think, a lot of Canadians who, look at the possibility of vaccination with some hope, and if they hear that, there might be 4 more lockdowns over the next 6 months, it's difficult to ensure compliance, I think.
Yeah, I wouldn't put it in terms of the lockdowns themselves. I think what we all Canadians need to recognize is that we all have a part to play. If you continue practicing, all of the important personal protective measures and really limit the number of contacts, stay at home and just go out for, let's say, essential activities like grocery shopping, then let's say with one dose, everyone will have a certain level of protection. But I would say that even with one dose, that's not enough to suddenly let Canadians free and say, oh, you can do what you want. We need to keep at it, get everyone with 2 doses of vaccine. And even then, we'll have to wait for the data because with 2 doses, I think we still have to see what happens in terms of the epidemiology. I would say also that it's interesting that, no vaccine is 100% effective, certainly a high level of protection. And hopefully, based on the data we're looking at right now, there's also a good indication that they also help to stop transmission because they also prevent infection. So that's all good news. But I would say that, it also depends on local context. So I just for an example, I would say that if you had even your 2 doses of vaccine in Halifax, as compared to, let's say, downtown Toronto, based on the local circumstances, I think what you may or may not do might be different. Obviously, I think everyone needs to listen to their local public health authorities who actually have the best understanding of what's happening on the ground.
Okay, Dr. Njoo, I'll leave it there. Thanks very much for your time this evening. Appreciate it.
You're very welcome.
Dr. Howard Njoo is Canada's Deputy Chief Public Health Officer. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.